Good afternoon. Hi, I'm Debbie. I'm calling in regards to Storm. This is a courtesy call from Dr. Doolittle. You are looking to possibly changing medications or switching medications. Is this correct? Great. I do see that you have a couple family members joining us, so if we're all present, let's get started. Amlodipine. Amlodipine is a class calcium channel blocker. So what that basically means is when you think of the word calcium, just think of the first letter C as calming. So we're calming the arteries, specifically the coronary artery in the heart, as you can see. The reason to take a medication like amlodipine, a calcium channel blocker, is for indications or reasons to take the medication such as high blood pressure. The pressure of the blood going into the artery, not the vein, the artery, shooting out away from the heart, and it is the pressure that's pushing against the arterial wall. So that is blood pressure, which causing the heart to have a harder time to pump what we need in order to have ample blood supply to the rest of our body. Just very simple, they're just tablets here. The prescribed amount will obviously be indicative of what your doctor tells you to take. It is a daily medication, so if you're a child or if you're an elderly adult, it will just be dependent on what you are prescribed to take and the dosage amount. So it is for, again, high blood pressure. It's also for stable angina and variant angina. Angina basically means ischemic chest pain, meaning that there is not enough blood flow to the heart and causing a pain within your chest. So stable meaning you were having this chest pain or lack of blood flow due to activity, emotional stress, whereas variant angina is where you are at rest and are still feeling the chest pain, where the artery in the heart, it is vasospasm. So you have your artery, but you have to remember your artery does have smooth muscles around it. So that is keeping it to be able to pump blood through the rest of your body. Well, this is the vasospasm that will happen, or the coronary artery spasm, the variant chest pain. And that is what's considered variant angina. Mechanism of action is to calm these arteries. We want to calm them so we can simultaneously drop the blood pressure, drop the heart rate. So it's relaxing these arteries right here. So calcium will be outside of the calcium channel blocker trying to get in. But what this calcium channel blocker does, your channels are blocking the calcium from coming in. With calcium, when it enters in, it will usually cause a contraction due to the electrical component of your heart, which leaves the arteries to become more relaxed. We're really trying to keep the workload off of your heart. Remember that we will monitor this. So we don't want to provide it to you if you already have existing lower blood pressure at the time or a low heart rate, so under 60 beats per minute. Side effects. For amlodipine specifically, we have peripheral edema. Edema really comes along with swelling, access fluid to wherever it is. So peripheral speaking, we're talking your arms, your legs. You will notice that they may become swollen. And so at that point, we definitely want you to report these kinds of side effects. Pulmonary edema. To the lesser extent, you could possibly experience abdominal pain, constipation, and even hypotension, which is fancy word of saying lower blood pressure or low blood pressure. Now getting to the serious issues to report. The signs and symptoms of peripheral edema, your arms, your legs, getting excess fluid in your lungs. This is something that should not be brushed aside. You will need to reach out to your provider and let them know exactly what it is that you're experiencing. Another serious issue to report is going to be exacerbation of angina. Angina, we're going to review again, it is chest pain. So exacerbation meaning it's worse. If your chest pain is worse, you will need to reach out to your provider. Another serious issue to report will be increased heart rate. Right here, radial, if you were to take your pulse and it's increased from your baseline, as in what you're normally at, when you check your pulse for a minute and check to see where your heart rate's at. How can you monitor this at home? Well, if you have a scale or some type of digital scale at home, please be sure to get a daily weight. Okay, so just check to see where you are, if you're retaining fluid in your body, if you're noticing quite an increase in weight, please reach out to your provider as soon as you can. And to go over, of course, checking your heart rate, as well as if you're already monitoring your blood pressure at home, that's also something that you can continue doing, and we would definitely encourage you to do. That's a good question, Storm. So the question being, can I stop the medication if I start to feel better? Let's not just drastically come off the medication. The medication itself would be needed to be tapered off by your physician, but it won't be something that you'll just completely cut cold turkey. It's just something that would cause a blood pressure to possibly get worse, and you might even have really bad chest pains. It just depends on the person, but it is just not advisable to just come off a calcium channel blocker such as Amlodipine. That's also a great question, Storm. How it is that this medication may affect your blood pressure medication. So there are a few medications you shouldn't be taking with Amlodipine. At this time, I could just suggest to speak with your provider, only because depending on the type of medication, like simvastatin, for example, these kinds of medications will interact with Amlodipine. It'll either decrease or increase the Amlodipine metabolism, causing it to not really do what it's supposed to do versus doing too much of what it's supposed to do. So it's closely monitored by your provider and dependent on you reporting and really being proactive on how you are feeling on the new medication. If you have a current liver complication, a liver disease, a liver ailment, you would have to maybe look into maybe lab reviews. A concern would be hepatotoxicity for someone who may have an underlying liver issue. Definitely speak to Dr. Doolittle and see what it is that he can suggest in regards to maybe switching medications or adding it with in conjunction with something else. We just want to be sure that you are being proactive and letting us know exactly what kind of signs and symptoms you might be experiencing. Great. Well, thank you so much for taking the time to speak with me. Any questions? No? Okay. Well, again, like I said, thank you so much. If you wanted to reach out to me, you know where to contact me at Dr. Doolittle's office. Please have a good day. Take care. Bye-bye.